Welcome to the Bodyguard podcast, where science meets natural healing to uncover the root causes of complex health issues. Your host, Christine Barnes, is a leading complex case health practitioner specializing in functional testing and personalized care. This show dives deep into clinical analysis, cutting-edge diagnostics, natural therapies, and holistic strategies to optimize your health and well-being. Your health is unique. Your healing should be too.
In today's episode, I'm going to unpack a common and often misunderstood dynamic in medicine. How a diagnostic label, whilst helpful, can sometimes act like a ceiling rather than a doorway in your healing journey. If you've ever heard or even said to yourself or heard of a diagnosis like I have XYZ diagnosis, you're not alone. From IBS to mast cell activation syndrome to histamine intolerance, even a broad spectrum of autoimmune conditions all have labels, and many patients come in feeling like they've reached the final answer with a sense of excitement. And here's the truth. More often than not, the diagnosis is not the root cause. It's frequently a symptom, a flag, a signal, but not the original or whole story. Let's talk about why that distinction matters and what to do about it. So there is a trap of what I call the diagnostic identity. When someone says, I have histamine intolerance, as an example, it feels definitive. But here's what I ask myself and of the case in clinic. Why is your body producing or reacting to histamine in the first place? Diagnoses like mast cell activation syndrome are syndromes, collections of symptoms grouped under a name or title. They tell us what's happening, but not why. Questions I ask in my brain are, is it a gut issue? Is there mold involved? Is there chronic stress or a history of trauma dysregulating the nervous system? Is the liver overwhelmed or underperforming? In complex cases, the body often presents through protective chaos, and I really love that term, protective chaos. Symptoms are like check engine lights. They are not the engine. Titles are tools and not necessarily the whole truth. As a clinician, I never dismiss a title. It can help give patients validation or even offer relief that something has a name and it's not a mental health issue or just going on in somebody's head. But I also remind patients a label is a snapshot, not the whole story. For example, a diagnosis like histamine intolerance might originate from gut dysbiosis, so an imbalance in the gut bacteria that then can lead to enzyme disruption of DAO, a particular enzyme. Mold exposure triggers chronic inflammation and histamine. Chronic infections like Lyme, Epstein-Barr, nervous system dysregulation, unresolved trauma, the list goes on. These root drivers often precede the histamine issue. So when we're thinking system-based or have a filter that we're thinking through, the case in a system-based way, it sometimes can be misleading, but often can help. So naturopathic and functional medicine both teach us the core truth. The body is a network, not a list of parts that are separated. And when we apply the lens, this lens that I'm speaking of now, we go from how do I reduce histamine to how do I support immune modulation, microbiome balance, cellular detox, or whatever the underlying cause or driver is, which in turn will reduce histamine overproduction. Do you see the difference in thinking and how this may change the treatment approach? Doesn't mean we don't treat the diagnostic title, but we dig further. Here's a case example. Patient comes in with mast cell activation, POTS, Stanlos syndrome. Instead of treating each separately, we look at nutritional imbalances, gut health, mitochondrial dysfunction, vagus nerve tone, limbic system dysregulation. The result? System-wide improvement, not just symptom suppression or a Band-Aid. So how to reframe your healing mindset? If you've been living with a diagnosis for years, here's a reframing mantra. My diagnosis is a clue, not a cage. Start asking better questions. What's upstream? I often talk about plumbing. What's upstream of the plumbing? What's triggered this cascade of symptoms? What came first? What other symptoms are speaking up, are talking to us? So whether it's hormone chaos, immune dysfunction, environmental toxicity, the key is to zoom out, connect the dots, zoom back in, get clear about those finite details, zoom back out, look at the person as a whole, and then take the necessary priority steps. So your diagnosis matters, that title matters, but it's not the whole truth. It's not your identity, and it's certainly not the end of the road. In my practice, we keep going, we go deeper, we ask better questions, we get better answers. If you're tired of symptom chasing, stick around. We're going to continue exploring what true long-term healing looks like over time. Until next time, my name's Christine Barnes, reminding you, your body isn't broken, it's speaking to you. Let's learn to listen.
That's a wrap for this episode of the Bodyguard podcast. We hope you found valuable insights to help you take control of your health journey. Want to dive deeper? Visit thebodyguard.com.au to learn more about our work, explore resources, and discover how personalised care can transform your well-being. If you enjoyed this episode, don't forget to share it with others on social media. Your support helps us reach more people looking for answers. Until next time, take care and keep prioritising your health, because your healing should be as unique as you are. Please note the information in this podcast is for educational purposes only and not a substitute for professional medical advice, diagnosis, or treatment. The Bodyguard accepts no liability for any loss or damage arising from the use of this content. Always consult a healthcare professional.